Hello, Mr. Erection. I am Dr. Seymour Wieners. I will be your urologist for the Turp surgery and will be addressing any questions you have about the procedure.
Yes, I do. I'd like to know why I am having this surgery. I've been dealing with these problems for quite a while.
Mr. Erection, the symptoms you've been complaining of, getting up to go to the bathroom many times during the night, frequent urinary tract infections as well as my finding of your benign enlarged prostate, indicate you are an excellent candidate for the Turp surgery.
What exactly is going to happen to me when I have this surgery?
I will insert a long slender tube into the tip of your penis. This tube is called a resectoscope. It has a light to allow me to see inside of your urethra, which is the tube that carries urine out of your body through your penis. The resectoscope also has a cutting instrument attached which will allow me to cut away the part of your prostate that is compressing your urethra and causing difficulty getting the urine out of your body. I am also having Nurse Ratchet meet with you today to give you additional information about this surgery and explain more in detail what to expect pre- and post-operatively.
Will I be asleep for the surgery? Will I be in pain? Will I be able to use the bathroom or have sex immediately after the surgery?
You will be under a general anesthetic and you will stay overnight as long as there are no complications, such as excessive clot passage. Because the surgery will cause trauma to your urethra, some blood will be present in your urine and you can expect to see some small pieces of tissue passing out of your body. We will place a catheter into your penis after the surgery in order to help the clots and urine pass without causing pressure to be placed on your urethra. Mr. Erection, I advise you not to have sex or engage in heavy lifting for a number of weeks after the surgery, but Nurse Ratchet will go over all of this with you in more detail about your care after the operation, as well as go over all pre-op lab work and instructions.
Hello, Mr. Erection. I am Nurse Ratchet and will be going over everything you will need to know about what to expect before and after your Turp surgery.
Okay.
Your surgery is scheduled for tomorrow morning at 8 a.m. You need to be there by 6:30 a.m. The surgery itself will take about an hour. And you will need to stay overnight for observations. Make sure you have nothing to eat or drink after midnight tonight. Also, you will need to make sure you give yourself a fleet enema this evening. Come wearing comfortable clothes. Do not bring any valuables, or wear any jewelry, including your wedding band. And make sure you have someone that can drive you to your surgery tomorrow morning, and drive you home the following day when you are released. Do you understand what I've told you so far?
Yes. I need to be at the hospital at 6:30 a.m. Nothing to eat after midnight. Clean out my bowels with an enema. Wear comfortable clothes, no valuables and no jewelry. Oh, and also make sure I have a driver lined up before and after the procedure.
Okay, good. There is also some lab work I will need you to get done when we are finished here today. I will also be meeting with you tomorrow morning to prep you for your surgery. I will go over your lab results with you. I will set up your IV, take your vital signs, and have you sign a consent form and also give you any medications you will need before they take you into surgery. Today I will also give you some reading material on what we have been discussing. Do you have any other questions or concerns?
No, I don't think so. I just want to get through this and be able to feel better.
And you will. Mr. Erection, I promise you that. Dr. Seymour Wieners is an excellent surgeon and knows what he is doing. It will take some time to feel 100% better, but choosing to do this surgery is the first step in that direction. Okay. Mr. Erection, I will see you tomorrow morning at the hospital, and the reading material I have for you as well as your lab slip are ready at the front desk for you to grab on the way out.
Okay. Thank you so much, and I will see you tomorrow morning.
Hello again. I need to make sure I have your information correct. You are Mr. Huge Erection, and what is your date of birth?
January 1st, 1960?
And I see here you are allergic to penicillin?
Yes. That is correct.
Now, you have not eaten or drank anything since midnight or taking any medications including anything herbal or over-the-counter, and have cleared your bowels with the fleet enema, correct?
That is correct.
You have also refrained from taking any NSAIDs such as ibuprofen, aspirin, or Motrin, correct?
Yes.
The doctor has reviewed your lab work and everything looks great. You have removed all jewelry including your wedding band, correct?
Yes, I have.
I will have you get into your hospital gown, and I will take your vitals and prep you for your IV. I will also have you sign the consent form for the surgery if you understand all of the information myself and Dr. Seymour Wieners has given you about the procedure, and agree to have it done.
Okay. I understand the procedure. I am just feeling a little anxious.
I will give you something that will ease your anxiety and make you feel more comfortable. Is that okay?
That would be great.
Nurse Betty will be seeing you right after surgery to explain the post-operative care she will be doing for you, as well as discuss any medications you will be prescribed, and what to expect with the urinary catheter you will have. If you have any questions, or there is anything else I can do for you, please don't hesitate to ask.
Hello, Mr. Rection. I am Nurse Betty and I will be going over all your pre-operative information with you today and tomorrow when you are released. Your surgery went very well and there were no complications. How are you feeling, Mr. Rection?
Well, I feel a little groggy, and I am in pain, of course.
And that is to be expected. I will be monitoring your vitals frequently and I will give you something for pain as well as something for the bladder spasms you will be experiencing, which is completely normal after this type of surgery. The doctor will also be starting you on some antibiotics as well. I will also be monitoring your urinary output from your catheter as well. And you will be staying overnight. Do you understand everything I've told you so far?
Yes, Nurse Betty. You will be checking on me frequently, and be giving me antibiotics, and something for pain and bladder spasms. And you are going to be monitoring my urine.
Good. About your urine. I do want to remind you that you will see blood mixed with your urine in the catheter bag, and this is completely normal. You may even see small amounts of tissue in there as well, but is nothing to be alarmed about. And if all goes well, you will be able to leave tomorrow morning. I will be in and out of your room checking on you, but please let me know if you need anything.
Thank you. I will.
Hello, Mr. Rection. How are you feeling?
I'm okay, still in a little pain, but it's better. I'm just ready to go home. Please tell me everything is good, and I can go home soon.
And that is exactly why I am here. You are doing well, and are able to be discharged. I just need to go over some post-operative home care information before you can leave. I am glad to see your wife is here with you and will be taking you home. Now you still have the catheter in you and will need to refrain from any unnecessary activity until it is removed.
My God. When do I get that thing removed? I was hoping you were going to take it out today.
You will most likely have to keep it in for another 24 to 48 hours, but you can talk to Dr. Wiener about that at your follow-up appointment tomorrow afternoon. But in the meantime, take it easy while you have it in. You may continue to have voiding symptoms for a variable amount of time, and this includes getting up at night, frequency, some hesitancy and blood in the urine. You may still have irritation and burning with urination for several weeks as the lining in your urethra heals. It may take as long as 6 to 8 weeks. You will most likely see some blood in your urine over the first 6 weeks. Do not be alarmed, even if the urine was clear for a while. But do notify the doctor right away if your urine is excessively and constantly bloody for more than 24 hours or looks like tomato soup. Do you understand what I have told you so far?
Yes. Doctor appointment tomorrow afternoon. Burning and irritation may occur when I urinate. There will be some blood in my urine. Call the doctor if it looks like tomato soup or there is a lot of blood for more than a day.
Good. Now the doctor is having me send you home with a prescription for pain, and a prescription for Detro, which is the medication that will help with the bladder spasms. You will also get a prescription for an antibiotic. You need to refrain from any heavy lifting for 4 to 6 weeks. Lift nothing over 10 pounds. No driving for 2 weeks. Short car rides under 20 minutes okay, but long car rides you need to wait 4 to 6 weeks for. Avoid taking baths, but showers are okay.
Now, Nurse Betty, I know we can't right away, but how long till I can have sex with my husband again?
That is something your husband will have to wait 4 to 6 weeks for also.
Oh Lord.
I would also like to go over diet instructions with you as well, Mr. Rection. You need to be drinking plenty of fluids. At least 8 to 10 glasses a day. It's okay to resume all your normal medications now, but you should increase your fiber intake as well to avoid any constipation issues due to the medications we are prescribing you. Do you understand everything so far?
Yes. No lifting, driving, long car rides, or sex for 4 to 6 weeks. Can't take all my regular meds. Will be prescribed an antibiotic, something for bladder spasms and something for pain. Drink lots of water, and increase fiber.
Also, notify the doctor if you are unable to void, your urine is persistently bloody for 24 hours, you have a swollen tender testicle, you have a swollen tender calf, leg, or you have a fever greater than 101 degrees Fahrenheit, and Mr. Rex and I will be sending you home with all of this information as well. So if you understand all the information I have given you, you can sign the discharge paperwork and be on your way.